You're watching Wisconsin Eye, an independent, nonprofit public affairs network, engaging the citizens of Wisconsin since 2007 through access to government proceedings and public policy events.
Of our fellow Wisconsinites having lost their lives to this virus. It's almost impossible to understand the impact of those numbers. They're so big that they seem removed from our lives, more theoretical or symbolic than real and tangible. But for the daughter who called to check on her dad who had COVID-19, only to hear him struggle to breathe, the numbers are not theoretical. For the nurses who knew their faces were the last their patients would see, their hands the last they would hold. For our healthcare professionals on the front lines of this pandemic, the numbers are all too real. This past year, over a year, has been a year of loss. Many of us have grieved loved ones lost, and all of us have had to deal with so much change. Changes to who we see, changes to how we interact, changes to where we go and what precautions we take. And after this long, I know it can feel overwhelming to hear that cases are still increasing and that we're still losing friends and neighbors to this virus. And that is why it is so important to get vaccinated. It is our most effective tool to get through this pandemic. And the more of us who get vaccinated, the faster we can get there. That is why we are doing everything we can to make the COVID-19 vaccine as accessible as possible to you. Our community-based vaccination sites in Barron, Douglas, La Crosse, Marathon, Racine, and Rock counties, all of them are taking walk-ins now. No appointment necessary. The same is true for the Wisconsin Center and other clinics across the state. So check out vaccinefinder.org to find a vaccine provider and information on appointments and clinics hours near you. We're also announcing a Vaccinator matching program today. Building on the success we've already seen with employer-based clinics in our state, this program will connect employers and community-based organizations directly with vaccinators. Together, these organizations and vaccinators can provide on-site or pop-up vaccination clinics for employees and community members. To find out more about the program and to connect your organization to a vaccine provider in your area, go to dhs.wisconsin.gov/vaccine and click on Partner Resources. As of today, we've administered 4,497,245 doses of COVID-19 vaccine in Wisconsin. 2,069,033 people have completed their vaccine series. Over 43% of Wisconsin residents have received at least one dose of vaccine, and over 75% of our residents aged 65 and older have completed their series. We are making progress, and each dose administered gets us closer. So today, as we pass this milestone of 600,000 cases, let us recommit. Recommit to preventing more cases and more deaths. Recommit to remembering that these numbers represent people and that this virus results in loss for far too many. And recommit to stopping it in its tracks. Thank you for getting vaccinated, for reaching out to friends and family to share your vaccine story and help them access appointments or walk-in clinics. And thank you for doing your part to stop the spread. And with that, I'll turn it back to you, Elizabeth, so we can take your questions.
Thank you, Deputy Secretary. And a reminder to maintain audio quality, please remain muted until it's time to ask your question. If you are able to do so, use *6 to mute and unmute your phone. And in the interest of time, to ensure everyone is able to ask a question, we ask you to limit yourself to just one question. And we begin today with Eric Gunn at the Wisconsin Examiner. Eric.
Hi, thank you for taking the question. With the supply and the demand changing as it is in vaccine use, are you seeing any increase in vaccine doses that have gone unused and had to be disposed of instead of administered? And if so, what kind of numbers are you seeing there? And if not, how has that been avoided at this point? Thank you.
Yeah, Eric, that's a great question. So, as we've talked about all along, this has been a challenging vaccine to administer, both because of the fragility of the vaccine, the storage requirements, and the multiple doses per vial. And while we've gotten really facile at the storage requirements and how to handle vaccines that have required ultra cold freezer as the Pfizer vaccine does, or just freezer as Moderna, or refrigeration as J&J does. The multi-dose vials are going to be a challenge as we move into this next phase of vaccination. So as always, I want to give a big shout out to our vaccinators who are working very hard to use every single dose. I was talking with a vaccinator this week in a big health system, and they're in a metro area, and when one clinic opens a 10-dose vial of Moderna vaccine, they put a report out on Teams so all the other clinics in their community know they have a vial open. And if a clinic, across town needs 3 doses, they let them know, and they are transporting those 3 doses over to that clinic to maximize the usage of that 10-dose vial. This is the kind of cooperation and coordination we're going to need amongst our health, particularly our health system vaccinators, as they move vaccine into clinical settings instead of mass clinic settings, which will be so critical for us getting this vaccine into more arms. But you are correct. We do anticipate that there will be more lost doses because that kind of coordination will not always be possible. And what we have said to our vaccinators, and we have consulted with CDC about this, is what's most important is that we don't miss any opportunities to get a vaccine into arms. And so there will be more opportunity or more incidences where you have a 10-dose vial. And, in the early days of vaccination, you might have 8 doses left at the end of the day, and you could walk out the front door and say, does anybody want a COVID vaccine? And you'd have 30 people raise their hands and want to get a vaccine. That's not as true anymore. And so the likelihood that those doses will be wasted is increasing. Just to give you a sense, we are seeing, in the range of 1,000 to 2,000 wasted doses over the last, or lost doses. I'm not going to call them wasted. They're just lost because of the storage requirements of this and the inability to use them, because we are working to get every dose into arms. So 1,000 to 2,000 doses per week, whereas earlier in the campaign, we were only seeing in the hundreds. So it is a consequence of where we're at in the process. We still are encouraging our vaccinators to be as prudent as they can be and use every dose as possible as they can. But also, please don't waste opportunities. If you have someone who wants to be vaccinated in front of you, puncture a vial, get a dose out, and get that person vaccinated.
Thank you for that. Let's go now to Elizabeth Wattis, WMTV in Madison. WMTV. And a reminder, *6 will mute and unmute your phone. Elizabeth at WMTV in Madison. All right, why don't we move on to Jonathan Sadowski, Up North News. Jonathan at Up North News. Okay, we'll try to get back to them. Scott Bauer, Associated Press. Scott Bauer.
Hey, I'm here. Thanks again for doing the call, everybody. Julie, just a couple of weeks ago, you had said that, it seemed possible to get to 80% vaccinated by July 4th. The president today is setting a new mark of 70% vaccinated by July 4th. From where you sit here in Wisconsin, what do you think is a reasonable place to be by the July 4th holiday? And can you just speak generally to herd immunity and what that means? There's been a lot of chatter about that recently and whether we're going to reach that point.
Yeah. Great question, Scott. So, I had an opportunity to hear Dr. Fauci talking about this morning too. And he made an important distinction about herd immunity that I want to share, which is herd immunity is really the level of immunity where we have enough immunity, either through vaccine or natural infection, to stall out the transmission of the virus. And so it's always going to be hard for us to know when we've hit herd immunity because, number one, we'll never know exactly what the level of natural infection is. We don't know how long it's going to last. And that's a hard thing to measure, which is the rationale for continuing to try and increase our immunity through vaccination because it is we can measure how many people have been vaccinated. And the other piece of it is we don't know what the number is that will actually result in that that stalling out of infection as described. So the bottom line for Dr. Fauci was we need to be less obsessed about the number of herd immunity and more focused on the value of continuing to increase vaccination because that is what will get us there. And so it's very difficult to make predictions about where we'll be by when. It's very clear we're not going to keep going up a percentage or two every day at this point in time. The cohort of people to be vaccinated is much smaller than it was when we started. If you think about on December 14th, Wisconsin has 5.8 million people. About 80% of them were of the age that they could receive this vaccine. So 4.6 million people. We're down to only about 2.1 million of those folks who are still waiting to get a first vaccine. That means we're not going to have as many people clamoring for every vaccine and every appointment. And the people who felt most at risk are likely the people who have already received their vaccine. So we are now talking with people who may certainly be interested in getting a vaccine, but it'll be on their own timetable. It'll be on their own schedule, and they may not be quite as eager. Here's a great example. I was speaking with people at the university this week, talking about students getting vaccines. We've hit this period of time where it's really easy for anyone to get a vaccine right as the end of the semester is hitting, right? So the students are focused on studying, finishing papers, preparing for final exams, getting ready for final exams. And, if you're thinking I can get a vaccine in May or I can get a vaccine in June after school is out, you're more likely to say, I'll just wait till June and not risk getting sick in the middle of ending the semester and preparing for finals. So it's a long way of saying it's hard to predict now because the group that will be receiving vaccine is going to continue to raise their hand and come forward, but not at the pace that they once were. And, my hope continues to be that we'll see robust acceptance of the vaccine moving forward, that, we'll start to get up in those 60, 70, 80% numbers. And the most important thing is that we continue to give people good information and easy access to the vaccine so they can make the best decision for them and their families.
Great, thank you. Next question to Rob Sussman, WTAQ in Green Bay. WTAQ in Green Bay.
Hi, yes, thanks for taking my question. The J&J vaccine, I know it started up again. How many Johnson & Johnson doses has the state of Wisconsin received, and are you seeing any hesitancy among the public in taking it? Thank you.
Oh, Rob, I don't know if I have the exact number of how many doses we've received. We'll have to get back to our vaccine team to answer that question for you. What I can tell you is we're of the vaccine that people had held during the pause, that they are starting to administer, as we're seeing around 1,000 doses a day are being administered throughout the state. I don't know. I'm not sure what the inventory was, so I'm not sure what percentage of the inventory that is. And we hear both things. We hear some folks, and it's not that different from what we heard before the pause. We're hearing some folks prefer the Moderna or Pfizer vaccine. We're hearing other folks really happy that the J&J vaccine is back because they only want one shot and they do not want to have to do a multi-dose series. Dr. Westergaard, I don't know if you're hearing any other perspective in your amongst clinicians that you would share.
No, I think there's a lot of attention among clinicians and in all sectors around what we learned about the risk of thrombocytopenia syndrome. The consensus among colleagues and a lot of us in the medical field is that the process worked the way that we would hope that it would. Is the pause allowed for a thorough synthesis of the available evidence, communication of the risk to important stakeholders who are on the medical provider side and also the public. And when we resumed administration of this vaccine, we were all in a stronger place, both with respect to understanding the risks associated, which we think are very small, and in my opinion, a lot of renewed faith in the adverse event monitoring system, that we could actually see a very weak signal of a previously unrecognized risk, detect that, and then translate that to actual action, where we thoughtfully considered the way forward, made the best evidence-based recommendations, and communicated that, and had large-scale policy shifts over a relatively short period of time. So I think it's very natural for people to look at this whole process and feel somewhat, a little bit more concerned about vaccine safety. But I think when you look at it in the way that I just framed out, that we should all feel much more comfortable and confident in our vaccine safety system, that we can find something that affects a very, very small number of people, understand it really well, and translate that and communicate it to a large number of people. So in short, I think there's a lot of pride that the system worked as well as it is. And I think medical providers feel equipped to discuss with patients about the risks and help them make an informed decision.
Thank you for that. Next question to Natalie Sopola, WAOW in Wausau. Natalie at WAOW.
Hi guys, thanks for taking my question. We've been seeing some stories circulating about the vaccine having some effect on women's periods. And we were wondering just if this is something that you guys are seeing at all, if this is something that women should be keeping a lookout for, or if this is, a myth that can be busted. Thank you.
Dr. Westergaard, do you have any information on that?
Sure. In the in the framework that I just mentioned about, finding safety signals among vaccinated people versus unvaccinated people, it hasn't risen to that level yet. I think there's been some anecdotal reports of women reporting changes in their cycles compared to regular. I would say that's generally very common, that patterns can change. There hasn't been any evidence that on average vaccines tend to influence that. So the short answer is no, we don't have anything that would rise to the level of this is something that people should be concerned about. But at the same time, like I just said, all new things are first detected by anecdotes and then thoroughly investigating them. And so that process is underway. But despite all the many doses of vaccine we've given, there's no evidence that this is more than a coincidence, and I think we have a good system to communicate if and when that would be the case.
Thank you for that. The next question to Stephanie Hoff at WisPolitics.
Hello, and thanks for taking my question today. So I have a question about the Biden administration's use it or lose it statement about states using the shots if they don't use them. And I'm just wondering if Wisconsin is in any danger of losing any COVID shots if we're not using them. I mean, how is this new approach impacting our state?
Yeah, thanks, Stephanie. I was able to be in a briefing this morning where this new policy was presented, and I think it's a rational policy moving forward to maximize vaccine across the country, and I do not believe it puts Wisconsin at any risk at this point in time. A couple of things I'd add. So first of all, the policy gives each state their weekly allocation based on population, the way they have been providing a weekly allocation to each of our states throughout the whole vaccine distribution period. And so Wisconsin loses no doses in our weekly allocation. And so as long as we order all of our doses, we will have them. If we don't order all of our doses, then any doses that we don't use that week will be put into this pool that can be requested from other states who need more vaccine. And then the next week, the whole clock starts all over again. We'll still receive our weekly allocation. And so it does not affect your future week's allocation. So I think it's a smart and wise way to think about how to maximize the use of doses throughout the country. The other thing is it's from this week moving forward. So any doses that we hadn't ordered, which isn't a lot, but we have a few doses we haven't yet ordered, are still in our Wisconsin bank, not lost to us. So I think it's a very rational approach, and in a way that if there are states that are not using their full allocation and others that need more, we'll be able to move those doses around the country without penalizing any state.
Thank you. Let's go now to Denise Lockwood, Racine County I. Denise at Racine County I. Nope. All right. How about Michelle Melby, Fox 11 in Green Bay? Fox 11 in Green Bay.
Hi there. Can you hear me?
Yes, go ahead.
Hi, I'm just wondering if there's any thoughts from the state or guidance on the possible expansion of eligibility for younger teens with the vaccines. Thanks.
Well, let me talk about it from a logistical standpoint, and then I'll ask Dr. Westergaard to comment on it from a clinical standpoint. So, we're eagerly awaiting the Federal Drug Administration's assessment of the Pfizer application for 12 to 15-year-olds. And as we have done with every vaccine up until now, we will follow whatever guidance they provide. If they do issue an emergency use authorization and the Advisory Committee on Immunization Practice recommends use of the vaccine in 12 to 15-year-olds, we will be ready to distribute that and support our vaccinators in administering that vaccine. I do want to emphasize this is an application for the Pfizer vaccine and only the Pfizer vaccine at this point in time. And so one of the things I would share with families who are considering this is vaccinefinder.org is a great place to look for that vaccine once it becomes available, because you can filter different vaccine sites in the state by the type of vaccine. So you can just look at sites that would have Pfizer vaccine and know that that's where you would go make an appointment. So those are some of the logistical pieces about this. We're certainly preparing for it and we'll be ready when and if it happens. But Dr. Westergaard, what would you say from a clinical perspective about this application?
Sure. You know, the clinical evidence, meaning the full set of data that was collected and analyzed through the clinical trial, hasn't been published, but it's been described and summarized at the same time that the company submitted their application for authorization to the FDA. And the results seemed highly analogous to what we learned about the level of effectiveness and safety in the adult population. So that was terrific news. It will depend on how the federal agencies review the totality of data, and they'll make their recommendation. But in general, we did not hear that there was any safety concerns. And in general, with many vaccines, younger people, children and adolescents, tend to mount very, very robust and very effective immune responses to vaccines. So I think there's lots of good reason to hope and expect that these are going to be very effective in children as they are in older adolescents and adults. And right now we're just waiting for the process to play out to make sure that all the data are analyzed, that the clinical recommendations are supported by the science that was generated through the clinical trials. And we're very hopeful that as this all comes together, we'll have another segment of our community that's eligible for vaccine, hopefully very soon.
Thank you for that. Next question goes to Danny Maxwell at WKOW. Danny. WKOW. All right, let's move on to Brittany Schmidt, WBAY in Green Bay. WBAY in Green Bay.
To kind of tag off of that, what population, how many kids do we have in the state that are from the 12 to 15, and then how does that play into, the herd immunity that you talked about? There are a lot of kids in the state, that transmission is high or available to be high in schools and stuff like that. So.
Well, there's approximately 300,000 children in that age group. And when I just want to talk about how I would ask Dr. Westergaard to comment about the impact this will have on children in schools. So on our website, when we are reporting percentages of people who are vaccinated, we are reporting out of the total population. So when we say 43.4% currently have their first vaccine, that's of the total population, of which almost 20% right now are not eligible, because that's about how many people are under the age of 16 in our state and not yet eligible for vaccine. So how it assists with when we think about herd immunity is there's now a new population of people in Wisconsin that are eligible for vaccine that can contribute towards moving that more complete component of the population forward in terms of being able to receive vaccine. So if we think about a target of vaccinating 80% of the eligible population, we're actually doing much better. We have 54.4% of the people who are currently eligible to get vaccine who have received it. But we report based on the total population because that's who we need to have immunity in order to do, as I was speaking about before, stop the spread of the vaccine in its tracks. It's of the total population. And you've seen it. And I'm going to turn to Dr. Westergaard, but as he has described, and we have demonstrated on our website, who has the highest rate incidence of infection right now? It's children under age 18 who are not eligible, largely not eligible for vaccine, and who has the lowest incidence of infection right now are people over 65 who have the highest rate of vaccine. So Dr. Westergaard, what more would you say about the impact of expansion to children 12 to 15 on our scenario here?
It's absolutely going to help. Not as much as if we took it all the way down to age 6 months or birth, right? But I think another helpful way to think about herd immunity and what that gets us is to think about it from the virus's perspective. Essentially, the virus is trying to not go extinct, right? It's trying to spread its genes so it can continue. And in order to do that, the virus, when it's growing inside a person, an infected person, it needs to find another susceptible person to complete its life cycle and have billions and billions of offspring to go infect other people. So if it can't do that, if it can't find another susceptible person to infect, those viruses are going to die out. It's essentially going to go extinct in our community. And the way that we can help the virus go extinct is to make it very difficult for the virus to jump from one person to another susceptible person. And the higher the proportion of people in our community that are essentially blocking the virus from being able to enter their bodies and cause an infection and replicate, it makes it harder for the virus to continue and eventually die out. Now, when I think about it in those terms, there's another important principle is that this concept of herd immunity, similar to what we talked about, a year ago, this concept of the reproductive number or R naught, these aren't necessarily intrinsic properties of the virus themselves. It also depends on how we behave, how the people behave. So the level of protection or the level of immunity that a virus needs to prevent to not go extinct is different depending on whether susceptible people are gathering closely to each other, or they're in large gatherings, or they're not wearing masks. So I think it's another theme that we want to hit is that herd immunity, immunity from vaccines and from natural infection are again one piece of our protection from against the epidemic that's sustaining. So we can make essentially herd immunity easier to happen by continuing to do traditional prevention like wearing masks and social distancing. We're more likely to get there. The level that we need to achieve herd immunity for the virus to peter out and not sustain in the community also depends on how hard we make it for it to spread from person to person.
Thank you for that. Let's go now to Sean Kirkby at Wisconsin Health News.
Hi, thanks for holding this. A few weeks ago, demand was still outpacing supply of COVID-19 vaccine in Wisconsin. Is that still the case?
No, we have turned the corner where we have now had more supply of vaccine available to us than our vaccinators have ordered. And it's becoming a very dynamic system. What we saw last week is a number of vaccinators who had requested vaccine on the survey they'd done 2 weeks prior, canceling some of their orders because they had sufficient inventory and they did not want to build up their inventory any further. And so, as you are aware, since December, we have distributed our vaccine based on a weekly or a bi-weekly survey system. And now that it seems like supply and demand are evening out here, we are preparing to go to an on-demand request system for our vaccinators. And so they'll be able to just request how much they want. We'll be able to order it and get into a more natural cadence as we do with many of our other vaccines moving forward.
Thank you. The next question goes to Madeline Anderson at Fox 6 in Milwaukee. Fox 6 in Milwaukee.
Hi there. It's been nearly 3.5 months, I believe, since people 65 and older in Wisconsin became eligible for the vaccine. And as you mentioned, I think 75% have completed their vaccine series. Has that population kind of reached its threshold for vaccination rate? And have you heard from people in that age group about why, 20% or so just haven't gotten the shot yet? And then does that concern you for the rest of the population's vaccination rate, since people 65 and older are among those most motivated to get the vaccine? Thank you.
So I think a couple of things I'd say about that. One is we're not done. We've, again, you have a early surge. The people who are most eager get vaccine first. Of course, we also had the federal pharmacy program that provided vaccine to a large portion of that population who live in long-term care facilities. So a very targeted outreach to that population. But every day, if you watch the 65 plus numbers, you'll see them creep up a little bit more. I think we're at 81.1% of people who have received their first dose. So we continue to hear and see people who are in that category who did not over the last 3.5 months opt for vaccine, but are now. We're also, need to continue to make vaccine more accessible to people. I continue to hear stories of people who are frustrated with online appointment systems, with, getting on the telephone and sometimes dead ending at a telephone number that tells them to go online and make an appointment. And so we have to keep improving our systems to make them accessible to people who may not find the computer the logical way to make an appointment for a vaccine. We need to continue to reach out, and we have given grants to our aging and disability resource centers to enroll them in reaching out to people in that 65 and plus population, and also people who have disabilities, to be sure that they know about the vaccine and that we are reducing barriers for them to get vaccine. A number of communities are working on programs to get to people who are homebound, who may not have been, it might not have been very easy in January or February for them to just jump out in the cold and get a vaccine at a clinic site. So we will continue to offer vaccine to people in that age category, and watch those numbers creep up a little bit at a time.
Thank you. The next question to Jonathan Kraus, WHBY in Appleton.
Good afternoon. The Oshkosh City Council recently amended their mask mandate ordinance to repeal the mandate when 50% of Winnebago County residents are fully vaccinated. What are your thoughts on that 50% threshold? And do you think treating those that are fully vaccinated like they're fully vaccinated will encourage more people to actually get fully vaccinated?
Yeah, I think it's really important that we give people hope and we help people understand what the opportunities are when they are fully vaccinated. I am thrilled that I happen to now, I'm not quite fully vaccinated, so I can't quite do this yet, but I'm thrilled at the opportunity to think about it, having people over for dinner at my home who are also fully vaccinated. And we now could have dinner together inside fully vaccinated people. I say I'm not fully vaccinated yet because I have 3 more days until I've hit the 2 weeks since my second dose. So there are a number of things as to when it's safe for enough people to be vaccinated to decrease our safety mechanisms like mask mandates. I think it's hard to say a number. Dr. Westergaard, I don't know if you have any comment on that. My gut is 50% is low, especially given the level of high disease transmission we continue to see in our state.
Yeah, that's what I think as well, is that it's for the proportion of people vaccinated is probably the biggest, most important piece of the equation, but it's not the whole equation. The level of transmission in a community also tells us how effective it is. Because vaccines aren't 100% effective for anybody, there's some residual risk for people for fully vaccinated, and that's going to continue to be the case until we have very low levels of transmission. So I think it's the spirit of policies like that, to set a goal and to provide some incentive and hope that there are things that we're going to be able to do to get back to normal once our community is mostly vaccinated are really good. But I think we want to hesitate and be very careful about making those levels arbitrary without paying attention to the level of disease transmission in a community, because that also influences the risk. And the updated CDC public health recommendations for people who have been fully vaccinated really capture some of those nuances, and understand that as a whole community, when there's a group of people who are vaccinated and unvaccinated, and there's still community spread, we probably don't want to do away with masks altogether until we're very confident that the epidemic has been controlled. That might not necessarily be the case when you reach an arbitrary level of vaccine. We have to look at that other piece about how much disease activity there is.
Thank you for that. Let's go now to Gabby Bechara, WISC in Madison. WISC.
Hi, thanks for taking my question. I was just wondering, I know we talked a little bit about 12 to 15-year-olds possibly eligible to get vaccinated very soon. What would be your advice to parents as they might be considering this, maybe a little bit hesitant about whether they should get their kids vaccinated?
Dr. Westergaard, you want to provide?
As I started to say before, I think the first step is to watch this process play out. The meetings where these data are reviewed and analyzed and discussed, and the clinical recommendations made, and the discussion about risks and benefits are all done publicly. The ACIP, the advisory committee of the CDC that just recently we saw in action, looking and thinking very carefully about the Johnson & Johnson vaccine. After the FDA makes its recommendation, they're going to similarly look at all of the data in public forums. Anyone can log in and see how they're going to make these recommendations. And so right now, I think that's the recommendation for everyone is, as clinicians, as medical providers, we don't want to recommend any treatment until we have very solid evidence that we feel and believe that the potential benefit outweighs the potential risk. And to that point, when the ACIP makes a clinical recommendation as sort of the endpoint for all of this research and analysis and consideration, when we get to that point, our hope is that we're going to have this great, very compelling body of evidence that we would not hesitate to recommend anyone in the population get that vaccine. Now, if that's not what the data say is the right thing to do, then we won't, and then we'll tailor our recommendations based on what the science tells us. So my encouragement to everyone right now is to just value and observe this process, so that when we get to the point where we have a clinical recommendation and our federal partners say, this is what we recommend, the benefit outweighs the risk, do this, or within this framework with a subset of population, whatever those are, is that we can trust that process, and both providers and patients and parents can feel very confident that they're doing something that's really based on good science.
Thank you for that. Let's give our next question now to McKenna Alexander, News 18 in Eau Claire.
Hi, thanks for taking my question. My question pertains to, so obviously right now the eligible age group is 16 and up, which is also the age where you can drive. So for this possible 12 to 15 age group where obviously they can't drive themselves to get a vaccine, what is kind of planning looking like as far as distribution? Will schools be involved? What's just kind of the outreach plan for that? Thank you.
Yeah, anytime we're doing a vaccine for a large population of children, we're going to look at multiple avenues for that. Many people are going to want to secure this vaccine with their normal healthcare provider. And so we have been working with our healthcare systems to be sure that our pediatricians have access to vaccine in their clinics. So increasing accessibility that way. Many parents want to take their child to their primary care provider for that. Likewise, our community-based vaccination clinics, those that are providing Pfizer vaccine are all ready to provide vaccine to children 12 to 15. They've already been doing that with children who are 16 to 17 and have worked through consent procedures for that. You're absolutely right. Sometimes children who are 16 and 17 can show up because they can drive. That's less likely to happen with children who are 12 to 15, obviously, because they can't get there on their own, although I suspect it might be bicycleable from a few locations. And like you mentioned, we're also working with schools. We have worked with schools on the 16 and 17-year-olds as well, and providing opportunities to either vaccinate at school, or in some cases, schools have looked at busing children to a community-based vaccination site for vaccine. And so looking at opportunities to use a school-based setting for this. You know, we're getting very close to the end of the school year. So I suspect our community-based venues and our healthcare system is going to be a more viable option for many families for this vaccine as we move into the summer months.
Thank you for that. Let's give the next question to Emily Davies, WSAW in Wausau. Emily.
Good afternoon. My question is in regards to the hospitalizations of current cases. So North Central Wisconsin, which is where we're located, is the only area that is growing in patients and hospitalizations. So I just wanted to see if talking with hospitals there or local health departments, if you guys have any indication as to why there is seen a growth. And if you can just confirm that the hospital and ICU beds, that's total available beds, not just COVID available beds. Thank you.
Yeah, it's total available beds. If you're referring to the beds on our website. Also, I think the WHA has total available beds available on their website as well, too. So just to clarify that. Well, hospitalizations grow when cases grow, and we know that. We know when we see increases in cases that within the next usually 10 to 20 days, we're going to see increases in hospitalizations. And then shortly after that, we're going to see increases in deaths. That is a pattern that has been well established throughout this pandemic. And we have seen it most recently. 4 to 6 weeks ago, we saw some rise in cases after a long period of time of our 7-day averages being down in the 300 to 400 range, and they started to rise up into that 600, 700, 800 range again. And you're going to see more hospitalizations when that happens. And that is indeed what we've seen. We have also started to see on the western and northwestern part of the state higher disease activity. Our suspicion is their proximity to Minnesota and the very high level of disease spread that we're seeing in neighboring states like Minnesota, Michigan, Illinois, have started to traverse into Wisconsin. And so that could certainly be a piece. I do want to emphasize that we have no evidence from any of our hospitals, even though that they are, some hospitals are seeing an increase in cases. No one is at a case level like they were last fall when we were running out of ICU beds or running out of medical surgical beds in order to care for people. The level of hospitalization throughout the state remains, thankfully, at a very manageable level.
Thank you for that. Let's go now to Molly Beck at the Milwaukee Journal-Sentinel.
Hi, thanks for having this call today. I was looking at the vaccine data, and it looks like the number of doses has dropped quite a bit since the peak in early April compared to last week. And I see just a few counties have more than half of their population with at least one dose at this point. I'm wondering if you could say if we are plateauing or dropping in demand, and if so, what is driving that primarily? Thanks.
So certainly we have seen a drop in demand. And in fact, I would call it a pretty precipitous drop in demand, and it has happened throughout the country. I meet regularly with other state health officials, and in many, many states, we saw a huge surge in requests for vaccine and demand for vaccine, and especially before we had enough vaccine. Then when supply started to stabilize and we opened up to larger and larger populations, people were very quickly able to get doses. And then very quickly we saw demand drop off here in Wisconsin, as we have seen in other places. And again, I also think it's really important for us to remember part of the reason demand has dropped off is we have vaccinated so many people. Again, we only have 2.1 million eligible people currently right now who have not received a vaccine compared to 4.64 million a few months ago. So just think about that. That's over double the number of people for every dose out there a few months ago. So the pool is smaller, and the people who are most eager or most anxious or most committed to getting vaccine largely have been able to secure a vaccine. And we are now working to get vaccine to people who either didn't have as much information, didn't have as easy an access, didn't have as much desire. They may be interested or somewhat interested, but they may need a little bit more information, a little bit more coaxing. And so we will continue to administer vaccines every day. Thousands of more people are starting their vaccine series, but we're not going to see tens and hundreds of thousands of people starting their vaccine series every day. So now is, if you climb a mountain, you climb and then you go on a plateau, right? And so, we've done the big ascent and now we're on the plateau. I don't know if there'll be another big ascent. Perhaps as we add new populations of children, we may see sudden surges in requests for vaccine for a new population. But we will continue to climb this mountain, whether we're on the steep ascent or on the plateau, to keep making sure that everyone in Wisconsin who wants a vaccine receives a vaccine.
Thank you. We go now to Kent Wainscott, WISN in Milwaukee. Kent.
Hi, thanks for taking my question. Julie, you just mentioned that you have seen surges whenever you've opened up eligibility to new groups, and you might anticipate that with the 12 to 15 age group if and when they become eligible. But not all vaccinators are administering the Pfizer vaccine at the moment. Do you anticipate having to adjust the vaccine disbursements to make Pfizer available to more vaccinators?
Yeah, that's a great question, Kent. one of the things earlier I was describing, we're going to go to an on-demand system for vaccine. Not only will that allow our vaccinators to just request vaccine as they need it, but we have also gone to allowing them to request what type of vaccine they would like to receive. So I do anticipate more of our vaccinators who have been relying primarily on Moderna or J&J, who have pediatric populations, may start to request supplies of Pfizer vaccine. And again, this is something I really want us all to express our great appreciation to the vaccine team here at DHS, because they've done an outstanding job of creating a system where we can get Pfizer anywhere in our state to vaccinators. It's a little bit more challenging because once it's out of the freezer, you only have so much period of time to use it. Thankfully, that time period has increased as we've learned more about the vaccine. But it does require a partnership on the part of vaccinators to make a really good estimate of how many people they have to vaccinate, communicate that to us, and then us to get that number of vaccines to them. But Wisconsin has done an outstanding job of getting Pfizer into rural areas of our state. Many states have primarily focused their Pfizer vaccine in urban areas where big health systems had big freezers that could store it. And we have had just great cooperation with health systems across the state who have stored the Pfizer vaccine for us, and then this great system of redistribution to smaller providers. So it is a great question. And I'll be frank, when it comes to kids, you may have to drive a little farther to get a vaccine because some providers may just not feel able to handle all the intricacies of the Pfizer vaccine, but we'll do everything that we can to help prepare them and deliver the vaccine to them. I suspect we'll never have it in 100% of locations, but our system will accommodate expanding to further locations.
Thank you. Let's give the next question now to Rose Schmidt at CBS 58. CBS 58.
Hi, thank you for taking my question. I appreciate it. We recently spoke to Senator Ron Johnson, who downplayed the effectiveness of masks, especially in schools. He is claiming to us that since children are not as likely to die of COVID, that masks should not be mandated in classrooms. I guess, what would you say to that, and how crucial are masks to keeping COVID out of classrooms and schools? Thanks for your time.
Dr. Westergaard, would you like to comment on the effectiveness of masks?
I think masks are our number one most effective tool to prevent the spread of COVID-19 indoor school settings. And I think the science is pretty clear on this. There's very, very good evidence to say that children don't have natural immunity. They become infected and they can spread the virus to others, both in their age group and in vulnerable older adults as well. So protecting the community means protecting every susceptible person to this infection. And in the absence of vaccine derived immunity, we need to do all those other things to prevent susceptible people from becoming infected, both to protect their health. And it's also very wrong to trivialize the potential for severe illness in children, because it does happen, both severe illness and also potentially long-term sequelae, such as we call post-acute COVID syndrome. So children are not, it's true that they are at lower risk for severe disease, but the risk is not zero, and the risk and the consequences can be serious. So we need to use all the tools we have to prevent infection among children. Masks to prevent the spread of infected respiratory particles is probably the cheapest and most effective thing that we have. So the last thing I'll say about that on mandates, and when I've given scientific presentations about this, it's something that I talk about a lot, is that, mandates are, no one likes rules or making things required. But behavioral science, social science tells us that when you do that, when you make things not optional, or when someone in a leadership position says, we're going to do this so we can all be on the same page and all protect each other, that makes a huge difference. We studied this on campuses. We saw that in these settings where there was a rule that sort of set the social norm for mask wearing, it was easy for everybody to do it. When you make it optional, people have to weigh, well, what are people going to think about me? Am I going to be judged for wearing or not wearing a mask? And when you do that, it just becomes complicated, and people tend to wear masks less than they might be comfortable than if they were comfortable wearing a mask in an environment where it was the rule or the accepted norm. So our recommendation and the recommendation of CDC for preventing disease in school settings is universal and correct use of face masks. And I strongly disagree with right now, given the level of community transmission and the low level of access to vaccines for people younger than 16, that we make masks not optional in school settings, but the norm in school settings until we're in a place with the epidemic that transmission in the community is low and we have high levels of vaccine-induced immunity.
Thank you for that. Now to Tom Durian, TMJ4 in Milwaukee. Tom. TMJ4 in Milwaukee, *6 will mute and unmute your phone. All right, well, moving on to the final outlet on our list, Wisconsin State Journal.
Yeah, hi, thank you. This question is a little bit like the hospitalizations, but slightly different. COVID deaths have been up in the state the last couple of weeks, with a fairly high number of 34 reported last Wednesday. Given that the vast majority of older people have been vaccinated and they're at most risk for deaths, why do you think that is?
Dr. Westergaard, would you like
to comment? Sure. There's probably not one explanation, but a subset of throughout the epidemic, a subset of people and have died. So there's no age group where we've not had fatalities. One thing that has changed in the epidemic in the past 3 months is that the virus that's circulating in the community is in fact deadlier than the strains of the virus that were circulating 6 months ago. We did not initially realize this or recognize this when the B117 variant of concern was detected in the United Kingdom in late 2020. It was very clear initially that it was more highly transmissible, meaning it spread more quickly from person to person. But it wasn't immediately apparent that it caused more severe disease. That took some additional research and some additional analysis. When they did that analysis, they found by comparing people who had the B117 variant and people that had the previously common variants, that there was a higher rate of deaths among those when you adjust with B117, when you adjust for comorbidities and other factors. The estimate from the largest single paper on this was that it was a 64% higher risk of death among the B117 variant than the not variants of concern. So in Wisconsin right now, greater than 60% of the viruses that are circulating are the B117 variant. So in the community, the virus that is spreading is more likely to cause severe disease and death than the virus that we had 6 months ago, and that's likely the case in all age groups.
All right. Thank you so much for that. And we are over time, so we will have to wrap up today's briefing right now. We want to thank Deputy Secretary Julie Willems Van Dijk, Dr. Ryan Westergaard, and all of you for participating in DHS Media, and continue to monitor the DHS COVID-19 web pages for data and guidance. You can find additional information on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Management. Be safe and have a great afternoon.
This program is a production of Wisconsin Eye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsin Eye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.